This morning I have the pleasure of introducing Dr. Dan Gerstein. Dan Gerstein is a senior policy researcher at RAND and professional policy analysis at Pardee Rand Graduate School. Previously, he served at the U.S. State Department or U.S. Department of Homeland Security as acting undersecretary and deputy undersecretary in the Science and Technology Directorate. Dr. Gerstein began his professional career in the U.S. Army, serving on 4 continents, participating in combat, peacekeeping, humanitarian assistance, counterterrorism, and homeland security roles. Following retirement from active duty, he joined L3 Corporation as Vice President for Homeland Security Services. Before joining DHS, Gerstein was the Principal Director for Counter WMD and OSD Policy. He also served on the Holbrooke delegation that negotiated the peace settlement in Bosnia, established Southcom's cybersecurity facility following 9/11, and developed a biosurveillance system for DoD. He has received many foreign, military, and civilian awards, including the U.S. Army Soldier's Medal for Heroism. He has published numerous books and articles on national security topics and is a member of the Council on Foreign Relations. Gerstein graduated from West Point and holds a PhD from George Mason University and a master's degrees from Georgia Tech, National Defense University, and Army Command and General Staff College. His panel today, or his presentation today, is on biological issues affecting the warfighter. And I turn it over to Dan for his presentation. Thank you.
Well, thanks, Adam, and thanks to AFCEA and to the U.S. Naval Institute. So obviously the slides are up. We're doing a slide presentation. The title is Biological Issues Affecting the Warfighter. And as we get into this, what I'd like to do is treat this subject with a little bit of balance. I'm going to talk about the full range of biological threats. I'm going to talk about things like bioterrorism and state use of biological weapons, but I'm also going to want to talk about the importance of continued work, research, development, and innovation in biotechnology. We don't want to lose that capability while we're worried about things like biosafety and biosecurity. So the other thing I want to do is talk a little bit about potential benefits to the warfighter of the biological investments that are being made now. And in between those two bookends, I'm going to talk some about COVID-19. And I do that because there are a lot of great lessons to be learned. And frankly, one of the bright spots in this COVID-19 was really the Department of Defense role in many respects. So I want to call some of those out. Now, as I go through the presentation, I'm going to talk about 4 basic themes. The first one is that the risk from biological agents is continuing to grow. In a sense, though, it's all due to human activities. The next theme is going to be that COVID-19 should have been a wake-up call for us. But unfortunately, it does not appear that we have heard that call. And it's something that we're dealing with even today as we think about the H5N1 avian influenza and what could happen if that developed the capacity for effective human-to-human transmission. So it's very important that we understand where we are. And we currently have lots of gaps in our preparedness and response. The third major theme is that the biotech revolution is going to result in the proliferation, or has resulted in the proliferation of technologies. But it's something that we have to continue, because if we want to be able to heal the world, to feed the world, and to fuel the world, we are going to need biotech solutions. And my fourth one is that biological issues have direct national security implications. And if we need one data point that tells us this, all we need to do is look at the aircraft carrier Theodore Roosevelt in the early days of COVID-19, making no value judgments about what the captain did, but he was faced with an intractable set of problems and not much in the way of guidance from national level public health authorities. So with that as my introduction, I want to take you through 5 slides. And this first slide, if you look on the left side, I want to talk about the bio threats, a bit of a historical perspective. I want to talk about the bioeconomy and biotech and dual use, and I want to talk about the likelihood of events. Now this is it's an eye test. I'm not expecting you to read all these. I want to give you the concept so that you understand where I'm coming from on this. So the top line of this chart talks about state-sponsored biological warfare. And we know that throughout modern recorded history, there have been some 20 to 25 nations that have had some sort of biological warfare program. Some of them were just doing research and development. Others had stockpiled pathogens. Others had stockpiled weapons and married weapons systems with the biological pathogens. Today, we have concerns about some 5 nations, and I won't surprise you if I give you those 5 nations as Russia, China, Iran, North Korea, and I would have said Syria, although I think that perhaps things may turn out differently with respect to that 5th nation. I spent a lot of time in my professional career looking at bioterrorism, trying to understand what it would take a bioterrorist to actually create a successful and effective biological weapon. You know, fortunately, we don't have much to go on in terms of historical precedents. So the ones that everybody talks about are the Rajneeshis back in the 80s. They used E. coli because they couldn't actually get a pathogen that had high mortality and morbidity. Shenriko, who tried to use anthrax but failed miserably, and despite being a $1 billion organization, turned to making rudimentary chemical weapons, including some sarin gas, and deployed that on the subway. The Amerithrax attacks, those are the following 9/11 attacks, and they were attributed to a worker from Fort Detrick. There's still some speculation that may not have been the case. Many of his colleagues don't necessarily think so. And then when U.S. forces went into Afghanistan, they also discovered a biological weapons lab that was being looked at or developed for Al-Qaeda. We also have a lot of different work that we have done looking at what the potential for a biological weapon is. And that little starburst I have says it in a nutshell. Biological weapons are indeed strategic weapons. And when I say strategic weapons, when you plot what a nuclear weapon could do, say a 10-kiloton nuclear weapon, and compare that to several pounds of purified toxin or bacteria or virus, you will actually see that the mortality caused by the biological weapons would likely be greater. Obviously, biological weapons are not going to destroy buildings, but they could turn cities uninhabitable. We also have a lot of naturally occurring disease, and you'll notice I've got in here several, like West Nile virus in 1999. It was the first time we saw it in the United States, and now it's endemic in the United States. That's due to climate change. It's due to mosquitoes that have traveled distances through aircraft and such to get to the United States. And now the diseases they carry are actually endemic in our country. You also see, for example, H5N1. That's that line that cuts across, starts in about 2005 and runs to the future. And why do I have that on there? Because today we're facing what could be the next pandemic, and we don't seem to be able to muster the interest to actually get excited about it. You know, when you look at the bottom of this little area, you see the U.S. decision to renounce biological weapons. That was in 1975. Actually, the decision to renounce was in 1969 by Nixon, but the BWC entry into force was in 1975. And so, you know, we have control measures, but the question is, are they useful? And so when I look at this top line, I say we have more and we have new threats that are out there. We also now have non-state actors that have state-like capabilities, which is something to watch very carefully. And the next is we have this rapid naturally occurring amplification of natural disease. When we think about this question of the bioeconomy and the biotech, I go back again to that point about the mid-1970s when at that time scientists began to get very concerned about what we call recombinant DNA. Today we would call it synthetic DNA or synthetic genomics. But the ability to actually synthesize from the elements into some sort of genome sequence. It could be a full genome, it could be just parts of a genome sequence. But they recognized even some 45 years ago the importance of having some sort of measures that would seek to control what we do with synthetic biology. And here again, we seem to have a lot of work going on in synthetic biology, but not always a lot of control measures that might limit those. So it's something to think about there. You go back to 2002, and that was the first time that we had seen the synthetic development of the polio virus. Somebody proved that you could take the basic elements, the amino acids, and put them together and create a synthetic polio virus. Some 7 years later, we saw the development of a synthetic bacteria. So we are on the cusp of a very, very frightening set of events. At the same time, look at those arrows down there. We have DIY bio, where people are doing essentially major experiments within their own homes on biological material. We also have the proliferation of what we call high containment laboratories. And this line talks to BSL-3 or above. When I was in government, I had 2 high containment laboratories, Plum Island that did agricultural biodefense, and the other one being the NBAC at Fort Detrick, the National Biodefense Analysis and Countermeasures Center, a BSL-4, the highest containment. The sorts of work that we were doing in there needed that kind of containment level. But now we have a proliferation around the globe, and there's some 1,500 of these high containment laboratories, BSL-3. This opens a proliferation window. And that last line talks to the democratization of biotech. That means it's spread more widely around the globe. More people have access to the technology. Many of us use it on a regular basis. We talk about CRISPR-Cas9 and all the different tools that are out there. What this means is, in the late 60s, when the offensive program was officially terminated, people used to talk about having good hands and working on the bench and having very specific skills. Today, many of those same skills are in a desktop configuration that looks the same size as a printer, and all you do is load in your pathogen, put in your seed stock, turn it on at the right temperature and pH, and you can literally create whatever pathogen you want at scale. And then it will do even better. It will harvest it for you and purify it on the way out. So you have a purified bacteria or virus. So we have a lot to think about there. I haven't even talked yet about artificial intelligence. But artificial intelligence is something that we have to think about too, the role of bioinformatics. Right now, we can't make a biological weapon necessarily using AI because we don't understand what the gene sequences mean to the observable characteristics. I call that genotype to phenotype. But we will eventually get there. And so there's another proliferation window. And then this idea of convergence of many technologies like AI, putting 3 different steps of a biological weapon into a single platform. Pretty amazing stuff. So here's my assessment. What I assess is that the potential for the state use of biological weapons has probably gone down. Less states are investigating it. There is a norm. The BWC, the Biological and Toxin Weapons Convention, gives you an unequivocal norm against the use of these types of weapons. So that keeps it at least something that causes states to have to think about it. But look at that line that starts about 2000 and goes up. The chance of an accident in a lab, the chance of misuse, and the chance of bioterror, all three of those, in my judgment, are continuing to grow. And then look at the red line above that, the naturally occurring and perhaps black swan events, like the COVID-19. And I really shouldn't call that a black swan event, because we knew the danger in coronaviruses. And again, it's a lot due to human behavior. So in that little starburst there, I put in each biological threat relates to or directly has human causes. In other words, we, through human activity, are the ones who are causing an increase in the risks associated with a biological spillover, a naturally occurring biological spillover, a lab leak, or a bioterror or state weapon. So let me put some of this in context. Let me talk about a naturally occurring spillover. And let's compare disease to combat deaths. So on the left are the combat deaths, and you look at World Wars I all the way through the Vietnam War. This is U.S. combat deaths, and that equates to approximately 650,000. And look at what we lost in 1918. We lost 675,000. So we lost more people through a naturally occurring 1918 influenza, the Great Influenza, than we did in all the wars in this century. And even if you put in the Iraq and Afghanistan, I think that statistic would still hold, because we lost about 8,000 or so. Look then at the number of smallpox worldwide and see how many people we've lost. Now, what I've done in this chart, you see that little arrow, well, that's pointing at COVID-19. And it shows COVID-19 as one of the largest spillover events that we've had, one of the largest pandemics that we've had, at 6.5 million as of 2020 and 2021. That has gone up, but associated with that are also what we call excess deaths, people who died associated with COVID. They may not have been assessed to have had COVID, but it's a death in excess of what the statistics would say. So pretty interesting to think about where COVID fits in. On the far right, this talks to the types of human behaviors that are causing this increase in pandemic potential. Things like deforestation, things like the human density, the population density, the ability of animals and human species to interact is setting the conditions for another pandemic. We know this. We understand this. In fact, with H5N1, we are one pig getting infected with H5N1 and doing a resortment of the pathogen, and we could have an airborne transmissible H5N1 pandemic that in some sectors they've talked about 30% mortality. Really a very, very high mortality. Think about COVID, which had, a 0.1 or 0.2% mortality. What I want to do now is talk a little bit about COVID. And I'll set the tone by talking about origins, how we think about the virus and the countermeasures, and what that means for the warfighter. DoD contributions, which I've already highlighted, have been really pretty astounding, and then the national shortfalls that I see. So you may have heard here recently that the new administration has just talked about looking again at the origins of COVID-19. And the intel community has come out with a new assessment that says that they assess with low confidence, so that's not very high, but low confidence, that it could have been a lab leak. But they also assess that it could have been a natural spillover. So the question is still out on that. I have written an article back about 3 years ago that talked about this lab leak theory. And what I say is, don't be binary. Don't look at this as either a spillover or a lab leak. It could easily have been workers going into the caves where they harvest coronaviruses for legitimate science and not decontaminating on the way out, and then, causing the virus to amplify within the human population. So it easily could have been one or the other. So on the virus and the countermeasures, I want to start at the bottom of the chart here and talk about this question of R0. R0 is a very important number. We call it the basic reproduction number. And what that means is that if you have an R0 of less than 1, then you have a pathogen, whether a bacteria or virus, which will not become a pandemic, because it means that, for it to be a pandemic, it has to be above 1, where every person who's infected infects at least one other person. Otherwise, it will just die out. And so when we talk about this, we think about virus properties, we think about pharmaceutical and non-pharmaceutical interventions as a way to control. This is really important because commanders can set the tone for 2 and 3, non-pharmaceutical interventions and pharmaceutical interventions. We can't do that much about the virus. I mean, that essentially will mutate and, it becomes more or less virulent, more or less transmissible. But if there are commanders out there, they should be thinking about, when do I implement social distancing? How about wearing the mask? What about infection control? What about quarantines? How about contact tracing within the unit or the ship that they're on? What about biosurveillance on the posts and camps and stations? How about having a testing capacity? And then for pharmaceutical interventions, we made great progress nationally when we think about how we reduced the mortality and cut down the R0 actually on the COVID-19. We did that by supportive care, antivirals in the case of viruses, or antibacterials in the case of bacteria, vaccines, and monoclonal antibodies. So we have a role to play in that. So here's where I want to talk a little bit about DoD's role, because I do think it was important. The Defense Production Act was used, I think, with great effect. I think there was also opportunities that were taken for preparedness and response, host nation coordination. Back to the origins, the first non-Chinese group to actually understand that COVID was out there was actually an organization from the U.S. Department of Defense, an intel unit that discovered it. So, that's, again, something that we have in our kit bag that's very important. The other thing we have are labs throughout the world, and those labs serve as surveillance for thinking about these issues. And then, of course, research, development, and innovation. And here, the thing I just say is, we were actually fortunate, it doesn't feel like it, but we were fortunate that it was a coronavirus, because we actually had ongoing work with DARPA, who was doing work on coronaviruses, specifically messenger RNA, specifically thinking about vaccine development against viral infections. So, we were actually much more fortunate than we give ourselves credit for. But that sort of work pays enormous dividends. So what are our shortfalls? We didn't do well in planning. This is a national issue. Our biosurveillance system is very much hindered. It's hindered by the states, frankly. We don't have a federal system, and every state makes its own decision on whether or not to share information with the federal government. So we need better collaboration, federal and state. We need better testing regimes. The CDC's test failed, so we need to think about that. We need better situation awareness. We have to talk to populations better, and better forensics and attribution. That would have helped us on the origins. Now this piece here I think is really interesting. This comes from a study I led at RAND Corporation. And we were trying to look at what makes a vaccine campaign successful or not successful. And we looked at 3 different campaigns that the DoD has been involved in. The first one, in chronological order, was anthrax, followed by smallpox, followed by COVID-19. The anthrax I would judge to be probably the least successful. And what we had done in doing this assessment is we looked at things like approval status, whether the groups were targeted, whether there was consistent messaging, how was the technology, was it looked upon as proven technology, was there disinformation, what was the perceived care in making this vaccine mandatory. And it's interesting that in the case of anthrax, it was probably the least well accepted because of the way it was rolled out. It was actually never approved for pneumonic anthrax, in other words, aerosol-delivered anthrax. It was actually for cutaneous anthrax. And so there were legal challenges by a group of warfighters, I'll call them soldiers, airmen, Marines, Navy, but that whole litigation actually slowed it down and it gave it a very bad name. So that's an interesting finding, and that really hurt the anthrax. And it continues this day to suffer from that. The other one, smallpox, is a fascinating one. Smallpox, of the 3 vaccines, is actually the most dangerous. It's actually the old vaccine used a vaccinia, an actual live virus, an attenuated live virus. And because of that, you had about 1% of the population that had severe consequences from taking the vaccine. But yet, when they messaged this, the first people to take the vaccine and the messaging was very consistent. The first people were the chairman of the Joint Chiefs, his deputies, they went senior leaders and special operations forces. And they told them, you need this if you're going into theater because we're worried about you getting exposed to smallpox. So isn't that interesting? And now the whole force gets smallpox and it's a different vaccine. But that one should have caused the most concern. And the third one that we looked at was COVID-19. And the issue with COVID was, I think the press made too much out of this. It's new technology, it's unproven technology. Certain groups don't trust vaccines. And so I think the press helped to reinforce negative attitudes about that. But this is where the chain of command comes in talking. When we think about COVID, the other thing that affected it was that the reserve component, who lives and works in communities, were the ones who were, if you will, the least willing to take the vaccine. For the Army, they were at about 89 and 90% when the rest of the military was up at 99.9% by 6 or 8 months afterward. So interesting findings. This is my last slide, and then we'll open it up for questions. Very quickly on the left, these are just some of the terms I use in talking about technology, the idea of the democratization and de-skilling. It's what I was describing with putting everything into a desktop printer, the dual use and disruptive technologies that biotech represents, the convergence of and recursive nature of building upon things like AI and other technologies, and then the funding. And the government is no longer the big funding in research, development, and innovation, and particularly not in the biotech space. Now, what are some general trends that are going to affect the warfighter? Well, the first is personalized medicine. If we want to get to personalized medicine, this is how we do it. Agricultural biotech are going to be very important for better abilities to, have high quality food, war fighters and such. Faster testing and approval of pharmaceutical projects. Environmental biotech, and here I'm talking about actually repairing runways and repairing bridges using biologically derived materials. There are many projects out there that are looking at how to do that. So instead of having to move heavy construction material in, you could actually use biologically derived materials. Some advanced concepts that are fascinating are enhanced human capabilities, looking at using biotech for that. Another one I think is interesting is the wearables, which creates the Internet of Bodies. In other words, anybody who's deployed becomes part of the Internet. That's a fascinating thing to consider. The third one down is also fascinating, and that has to do with this idea of brain-computer interfaces. And we have really come a long way in that. Today we're doing work on things like people with ALS, Lou Gehrig's disease, and Parkinson's disease, and people who have been injured in accidents. But we have restored functionality at least, not full functionality, but we have restored a lot of functionality for people in measurable ways. And we're looking at some point, not in the too distant future, about having brain-computer interfaces where we would put these kinds of interfaces where you'd have the biological interface and the electromechanical interfaces within the human brain and have the ability to store information within DNA. These are the sorts of things that we're talking about. Lots of interesting opportunities if that occurs. And then the idea of augmented humanity, which ties into brain-computer interfaces. Some of these programs the DoD is already looking at, particularly DARPA, things like detecting novel threats and force health protection, the physiological interventions to maintain operational advantages, warfighter peak performance, and operational biotech. Again, getting back to this idea of food, medicines, and materials. Okay, so with that, I am available to take your questions. Please.
Yes, thank you. Mark Coleman with Precise Systems. Appreciate the information. A characteristic of human behavior that I think is relevant here is the idea that you can't surge trust. You touched on it a little bit, I think, in the chain of custody on the earlier slide. How do you think we can help to incentivize the population to understand that the risks truly are there and to believe the remedies or protective measures are actually useful with all of the misinformation, disinformation that's out there? How do we create the trust now before we actually need it?
Yeah, I mean, I think this is a great question, and it's not just on vaccines, it's on therapeutics as well. It's on things like masking. But, like I teach a course in pandemics at American University, and, I have this chart that I use that shows different demographics over time, and it shows mortality to different groups. So it looks at white, black, Hispanic, Asian. And it's fairly extraordinary, the differences. And what you're seeing is that different communities seem to be absorbing messages very differently. The Asian population was up in the high 70s, and at the lower end of that, the white population wasn't that much higher than the black population, and the black population was in the high 50s or high 40s. And so, those represent people who probably died, groups, demographics that lost people because they didn't adhere to the guidance. But I also have to say that science has to be more appreciating of the way people feel and has to meet people where they are and talk in terms that people understand and why it's important to mask, what it does. What I also take away is you kind of get one chance. Because if the news keeps being, the messenger RNA is unproven technology, it's all new, it's this, and we heard stories about how people were being experimented on with messenger RNA. Those things weren't true. I mean, it went through clinical trials, but, unfortunately, once you lose the narrative, and it's just like anything in the military, once you lose the narrative, it's hard to get it back. And so, you've got to be well crafted, it has to be well understood. You have to have a supportive government at all levels that's pushing this, explaining to their people. The farther down on the food chain you get, the more the people trust their government. So it can't just be a federal message. It has to be embraced at lower levels. It's a good question. It's a hard question.
Doctor, my name is Russ Kegabine. I'm a retired Supply Corps person. I'm also an old farm boy. To what extent, you had mentioned that there's not a national coordination on some of these things, but I'm thinking in terms of the big land grants that have got a vet school, they've got a med school, you've got the food science guys. To what extent is there an informal network, or is anyone monitoring what's going on with these big ag production areas and what they're seeing come out of those?
Yeah, another good question. I had an opportunity twice during COVID to testify to the House and the Senate on some of these issues, including agricultural biodefense. And what's fascinating is that before COVID-19, we always talked about agriculture being a critical infrastructure area, but we didn't really know what that meant. And, we were talking about, vaccinations of animals, and that's very important. In fact, my organization actually created a foot and mouth disease vaccine that's in use today. But what we came to appreciate was that even if all your animals are fine, if you don't have the workers and you don't have the production plants, it creates a bottleneck, and it means that you're not going to have food on shelves, you're going to experience shortage, you're going to have high prices and inflation, and that's everything we saw. So it's very predictable, and what we're trying to think our way through, again, I came from DHS where I thought a lot about the critical infrastructure areas and how to protect them. It's a really hard problem because they touch these are very large areas, and they cut across large swaths of our country. And so doing that really takes kind of a concerted effort. We recognize, for example, that the workers in the plants, some of them being undocumented immigrants, et cetera, we have to think about how do we reach them with the non-pharmaceutical interventions, because we get a break in the supply chain, and it's going to affect us all. I mean, the military's supply chains were broken, and they couldn't get access to microchips. They were unable to get proper N95 masks. The masking was a problem. So if as soon as you break that, it's a problem, and as soon as you go over the requirements that have been historically set, you have a problem. So more work to do on supply chains. I will say that since COVID, I think everybody now has heard supply chain a couple of hundred times, which is something that is good, because I don't think many people thought about that beforehand. But good question there. Other questions?
Morning, Dr. Gerstein. Scott White. I actually a Navy PEO C4I guy, but I support the Joint Program Executive Officer for Chem Biodefense. I think we go back a few years together, maybe under the days of Andy Weber.
Yes.
I was wondering if you could elaborate on the biosurveillance system that you helped build for DoD. Does it still exist? I was the PM for the Global Biosurveillance Portal, so I'm just curious where that went. Thank you, sir.
Yeah, so what the gentleman's alluding to is before I left the Department of Defense as the Principal Director for Countering Weapons of Mass Destruction, I wrote it was a team of people from across the staff, but I supervised the writing of a DoD biosurveillance strategy. It was signed off by the Secretary of Defense. And the principal offices were my office, Andy Weber's office, who had the Nuke Chem Bio, and then Office of Health Affairs. And, pieces of that system still exist. But frankly, it's something that unless people have a passion for it, it's not something that continues it's not a self-fulfilling prophecy. And so we still have GICE, which is the Global Emerging Infectious Disease Surveillance. We still have the laboratories that are under GICE that do the surveillance activities. They're around the world. We have one in Peru, we had one in Thailand, we had one in Egypt. But those are very important. Why are they important? Because just like you heard when we had the briefings yesterday for the opening session, it's having allies and partners, it's sharing information, it's understanding how the situations are changing so that you can act to them in real time. And so, these kinds of things, including that medical intelligence unit that I discussed, were very important to our understandings of COVID in the early days. I mean, we had a pretty good sense that there was some kind of airborne respiratory disease that was emanating from in the Wuhan area sometime around mid-November. And we didn't act on it. We didn't get a sequence until shortly after the first of the year. And so, that creates a bottleneck. And, our new goals are really to be able to have the biosurveillance in place, do the testing that supports the biosurveillance. I'll come back to that. And then to be able to have a vaccine in place within, it took us 9 months from the time we got the sequence to have an approved certified vaccine. We want to be able to do that in under 90 days. Some have even said in weeks. So I think that's very important. The other thing that we have tried to do, and we're getting some success, CDC is doing it, the Centers for Disease Control and Prevention. They have created a wastewater surveillance system. So if states and locals will let you get into their wastewater, you can be looking for things. So now some of this gets a little sensitive because, states and locals may not want to, have it known that they're having an outbreak of measles, or that they have an increase in cocaine or fentanyl. You can see those things in wastewater. You can't pinpoint where they came from, but you know that upstream of that point, you have a higher prevalence of whatever you're looking for. And so wastewater surveillance has turned out to be very interesting, but it tends to be a bit of either a here and now or a rear view mirror, because you're seeing it as it comes through. We've tried to think about, could you do something like with aircraft? Drain the waste tanks on the aircraft before they take off, and then once they get to the other side, drain them again and test it all to see what pathogens are in there, so that you would know, did we just bring a load of people with, COVID-19? But that, again, that's rear view mirror stuff, because the people are already through and all the screening done. I have time for one more question. Any last takers? Okay, well, I thank you and enjoyed the presentation to you. Thanks.